To be prepared is half the victory, said Spanish writer Miguel de Cervantes Saavedra. And in the world of successful marketing, being prepared means executing solid research before putting a marketing plan into action. The case study explored in this presentation will demonstrate how a thorough and methodical research program laid the groundwork for a highly effective communications campaign, a campaign that helped enroll more than 1 million uninsured U.S. children in the state Children's Health Insurance Program. The research, among many other findings, disproved some of the assumed barriers that healthcare providers first thought would make communications difficult with the children's parents. This clear insight into the minds of the target audience helped the resulting promotional campaign pinpoint its message effectively. And it won the Foundation and its research and advertising teams the 2002 David Ogilvy Research Award, a prestigious recognition of research that contributes to highly successful advertising.
This isn't just about advertising. It's not just about PR. It's a comprehensive integrated campaign. And Worthland's research is embedded in all the different elements of that comprehensive campaign.
There were more than 10 million, perhaps 11 million kids in the United States who were uninsured. And what's remarkable is that the vast majority of those children were eligible for public programs but were not enrolled.
Many of these people simply did not realize that they might be eligible for coverage under this new insurance program.
In 1997, the Federal Balanced Budget Act funded a $24 billion program called the State Children's Health Insurance Program, or SCHIP. This program provides payment for prescriptions and doctor's visits for children whose working parents don't have insurance or health care benefits.
The Robert Wood Johnson Foundation is the largest foundation in the United States that is dedicated solely to improving the health and health care of all Americans. It has a special focus on Americans who are vulnerable, either because they come from families that are low income, or they live in minority communities, or they're people who, for one reason or another, have had a chronic illness during the course of their life. The foundation uses its considerable assets to improve health care for them in a number of different ways, and covering kids is one of those efforts.
In the past, government agencies had not found an effective way to reach the parents of the huge number of children who could benefit from the SCHIP and Medicaid programs. Each state had different ways of sharing information about its programs. Fortunately, there was an 800 telephone number that seamlessly routed all the telephone calls to the correct state office. To find a better way of communicating, the Covering Kids Initiative created a coalition of government agencies and children's advocates, and they spent 2 years developing programs that simplified and coordinated the enrollment process. Despite their solid planning, representatives in the healthcare field thought that the parents of eligible children might avoid the medical programs for fear of being stigmatized as welfare recipients. The foundation needed to know if the fear of stigma would be a major hurdle to enrollment. If it was, should the communication program focus on reducing that fear? Should communications concentrate on program benefits, or to try to show that the enrollment process was easy? Did the communications plan need to share all of these messages? What would motivate parents to enroll their children in the program? With its expertise in public issues, Worthland Worldwide was selected from 5 other competitors to head up the critical research arm of the project.
Worthland was perfect for this project because of the way we approach research and developing strategy that would uncover the emotional reasons why people need health care for their kids and what that would help them achieve.
One of the most remarkable things about Worthland Worldwide and the team that worked on this campaign is how they dealt with the time schedule that we handed them. We asked them in April of 2000 to deliver market research that would help us get ads up in the air in August of that year. They hit the ground running. They conducted a broad national survey, in-depth individual interviews, focus groups, dial testing, tested all of our creatives, and got it done in a very, very short period of time.
Worthland Worldwide's national study would serve several important functions. Not only would it provide information to steer the communications campaign, it would also offer data that could be used to pitch news stories, and it would create baseline information that post-communications could be measured against to see how successful the plan had been. The research plan began with the National Quorum U.S. Omnibus Survey that measured the perceptions of several different groups of people and quickly showed that consumer awareness of S-CHIP's assistance was low. The research team surveyed state-level opinion leaders, capital policymakers on Capitol Hill, and focus groups of caseworkers and others who administered S-CHIP or Medicaid.
This is a hard audience to reach through standard research techniques because they are low-income families, they're working oftentimes a couple different jobs, and they're not in the home and easy to access. And even through doing standard telephone studies, it's a very costly adventure because you have to dial thousands upon thousands of numbers until you find a household that qualifies, that is someone who's eligible but not enrolled in the program. And we had to do this in just a couple of months, qualitative and quantitative, of 3,000 interviews across the country.
The interviews revealed that only 42% of Americans were aware of the programs. Only 55% of S-CHIP's eligible parents knew about any low-cost healthcare options, and only 22% of that group knew about S-CHIP. Worthland Worldwide used a proprietary surveying methodology they developed called the VISTA Consumer Decision Mapping during the in-depth interviews.
We had to use sampling techniques that increased the likelihood that we got into a home that was in the right income level and that had a child. And then we had to bring in our resources with our phone centers to maximize their capacity to dial nonstop for 2 to 3 weeks to get the 3,000 interviews completed. And in the process, we had to balance the need to have a representative sample done in the right methodological way, but in a way that we could do it fast enough to get results.
Worthland has a unique approach called values-based research, and it goes way beyond what a traditional polling firm will do. It doesn't just tell you what people think up here, but truly what they feel in their heart.
One of the things we do at Worthland as part of our strategy approach is to interview people using a technique that's referred to as laddering generically. We have specially trained interviewers who have been trained in what is essentially a psychological interviewing technique to probe people in a way to really drive into their personal emotions.
When we sat down with these parents, we discovered they value caring for their child and having access to a doctor just as much as any other parent. The problem was that they could not afford it. They had to make difficult choices that got in the way. And secondly, the biggest reason they weren't enrolling, they didn't believe these programs were even designed for them. They were self-deselecting because they felt like I would not be eligible.
The early research showed that the most successful advertising and public relations campaign would communicate this message: signing up for low-cost or free health care coverage will help you be good parents who make smart decisions that will reduce your stress and bring you peace of mind. This summary message became the strategy statement that drove the advertising development. The research also showed that the greatest barrier to good communications was the parents' low awareness of S-CHIPs and Medicaid.
What the research that Worthland conducted found is that, in fact, something really obvious needed to be discovered, that the vast majority of these parents had no idea that their kids were eligible.
Message testing revealed that 86% of the parents strongly believed that being a good parent meant making sure their children had health insurance coverage, which disproved the early belief that parents weren't enrolling their children because health care wasn't important to them. In actuality, they didn't think they could afford it. Once the initial research was completed, GMMB crafted the creative campaign.
They were able to give us some great strategic insight in terms of how to craft messages that really reach out and touch people's emotional beings so that they can think about how they can best take care of their families.
Today, parents have a lot of hard choices. Pay the phone bill or pay the doctor. Fill the fridge or fill a prescription. But there's a choice that can make life easier, calling 1-877-KIDS-NOW. That's because every state now offers low-cost and free health coverage for kids. Even working families can get the card for doctor visits, prescriptions, and more. So if your kids aren't insured, call 1-877-KIDS-NOW. Write it down, because you've got enough to worry about.
At first, we started with dozens of 30-second television scripts. We narrowed that down eventually to 9 television scripts that we produced on videotape and took them into pulse line testing.
The thing about Pulse Line that makes it special is that we gather a group of the same audience that we're trying to reach, and they use a handheld device that allows us to gauge exactly how they're responding on a moment-by-moment basis. It allowed us to hone in on specific words and phrases that seemed to work more effectively, and it also allowed us to identify where a specific concept that we might have been trying to convey in the ad wasn't getting through as strongly as we wanted to.
The biggest turning point was when we switched to using language like even working families making $35,000 or more may qualify to get the card. Suddenly, in their mind, the light bulb came on. I might be eligible. I might qualify. It's worth the call.
We go beyond changing attitudes and really understand what it is you need to say to change behavior. And it's the mantra at Worthland that says, you persuade by reason, but you motivate through emotion.
The Worthland research was able to tap into that emotional dimension and find out exactly what it is that makes a parent want to take the action to get their kid enrolled.
When Michael used to get asthma attacks, it was pretty scary. I'd stay home from work, we'd go to the doctor, and things would get better. At least until I saw the bills. Talk about scary. But now he's covered, and that's a load off my mind.
Every state now offers low-cost and free health coverage for kids. Even many working families can get the card for doctor visits, prescriptions, and more.
Call 1-877-KIDS-NOW, and you'll breathe easier too.
After the creative campaign was launched across the country and intensified during the back-to-school and winter cold and flu seasons, the results of the Covering Kids initiative's methodical, thoroughly researched approach began to pour into GMMB's tracking staff.
After we ran the advertising, Worthland went back in and did post-advertising surveys, and the results were fascinating.
The number of families responding during the advertising period in target markets increased dramatically, from a high of more than 600% in one market to a low of still more than a 70% increase. Really phenomenal numbers.
Naturally, we could track the calls that came in, and that showed tremendous success. But we also designed a test and control market approach to where we knew from immediately before the ads to immediately after how much of a difference we made in 6 out of 10 of these households actually seeing the ads, and then 1 of 4 of those actually calling, as compared to a control market where the same measurements didn't take place. Then we knew that we had done the comprehensive job the foundation had asked us to deliver.
While most states chose to publicize their own toll-free hotline number, making it difficult to determine the true number of calls, GMMB released a significantly understated report that more than 500,000 calls were made to the national hotline in a few target markets from 2000 to 2003. Worthland Worldwide conducted a hotline survey in 3 media markets and learned that as many as 95% of callers said they learned about the program through advertisements.
Some of the results that we found in the survey research of the pre-post measurements were that 6 out of 10 families who were eligible for CHIP or Medicaid in that media market saw one of the ads and could remember having seen it. And out of those who saw the ads, we know that more than 1 out of every 4 actually called and asked for an application, which in a direct response campaign is a huge number. To be able to know that with that execution in a 2 to 3 week time, you're able to penetrate a low-income working audience that's always at work, but still 6 out of 10 saw it and 1 out of 4 of those called.
The agency tracked nearly 15,700 news stories that reached an estimated 78,850,000 Americans, and 6,000 radio stations picked up the audio news releases.
We're applying techniques that are used all over to sell anything from toothpaste to dog food to cars. But wow, we're helping kids actually have a better chance of succeeding because their parents know now that there's an option to care for their health needs.
A true testimony to Miguel de Cervantes Saavedra's assertion that to be prepared is half the victory.